All right, so we are in the week of October 26th through the 29th. Yes, so we are in the week of October 26th through the 29th. So we are finishing up cardiovascular systems, and we are starting lymphatic system and body defenses. All right, so this week you'll have an exam over chapters 9, 10, and 11. Okay, so that would be endocrine system, blood, and cardiovascular system. So will lymphatic system and body defenses be on your exam? No, right? It's chapter 12. Your exam's over 9, 10, and 11. So I want to make sure you know exactly what to study. We're covering it this week in lecture. It's not going to be on your exam, okay? So read it so you keep up with the material, but it's not going to be your primary focus, obviously, right? So just want to make sure you're aware of that. Okay, so let's pick up where we left off. Talking about physiology of circulation. So I believe last class we finished up talking about ADH, antidiuretic hormone, renin, angiotensin, and atrial natriuretic hormone, and how they help maintain blood volume and sodium levels. Okay? Yes, it is. Boom. Just like that. Thank you. All right. So with physiology of circulation, you got to think about how you evaluate your circulation. Okay, in the picture here, you see some of those major arteries in the body. Remember, arteries taking blood away from the heart. So how do we evaluate your circulation? One of the ways we can do that is by taking a patient's pulse. Okay, anybody ever taken your own pulse or a patient's pulse? Okay, so what is happening during that time? Well, you have this alternating or cycle of expansion and then recoil of the walls in your arteries, excuse me. So you have this expansion, recoil in those arterial walls. And it's actually palpable, or basically it means you can feel it in the more superficial arteries, the ones that are closer to the skin. And that would include the radial artery, right? And the common carotid artery. So you've probably seen people take people's pulses in the throat up here or by the wrist, okay? Common carotid artery up here at the throat, and radial artery by the thumb, okay? Or on the wrist, on the thumb side, okay? So your pulse rate is generally going to give you a sense of how fast your heart's beating or how fast the patient's heart's beating, okay? So give a sense of the heart rate. So another way you can evaluate person's circulation or patient circulation is through blood pressure. All right. Anybody ever get their blood pressure taken at the pharmacy or the grocery store in those machines, or at a doctor's office, or you've done it for someone else? So the artery that we're typically measuring with blood pressure is the brachial artery. Okay. We use a machine called a sphygmomanometer. All right, say that 3 times fast, right? So it's an instrument that records changes in blood pressure. Your blood pressure cuff gets inflated, right? You press it and it inflates till there's no blood flow through that brachial artery. And you start hearing what we call Korotkoff sounds. And these are produced when that pressure in that cuff gets released. Okay, so they do the blood pressure till you cut off blood flow, and then they start releasing the air slightly, right? So when you start hearing blood hitting those arterial walls, okay, it gives you a sense of the systolic pressure, okay? And remember, what is systole? Systole has to do with atrial contraction, right? Okay, link back to what we talked about last week. Diastole having to do with ventricular contraction, okay? So when the sound's in, that's when you record diastolic pressure. All right, so normal blood pressure, right? 120/80. Again, the higher numbers are systolic pressure, lower numbers are diastolic pressure. And systolic pressure tells you the pressure when your left ventricle is contracting. Okay, so it's really, to be more clear, systolic pressure has to do with ventricular contraction. Okay, and diastolic pressure has to do with ventricular relaxation. So I want to make sure you get that. So that's important. Systolic ventricular contraction, diastolic ventricular relaxation. Okay. All right, so hypertension. Anybody heard of hypertension? Okay, patients sometimes have this. It's a fancy term for high blood pressure. Okay, should make sense from the word, right? Hyper is high or more. Tension has to do with tension in the blood vessel, which creates blood pressure. And this usually happens when the systolic pressure is 140 or more. Diastolic pressure is 90 or more. Okay, so if the pressure on the left ventricle contracts is more than 140, that's an indicator of high blood pressure. If the pressure when the left ventricle relaxes is greater than 90, okay, high blood pressure. Okay, let's talk about the route or routes that blood takes around your body. So we're going to talk about the pulmonary circuit. Okay. So if you think about it, anybody do circuit training for exercise? Anybody ever do circuit training? Okay, it's when you do a series of exercises over and over again. Okay, each set or repetition of all the exercises is a circuit. All right, so we're going around in a loop. So the blood from the body is going to start collecting down in the right atrium. So from there, blood's going to go, when the atria contracts, blood's going to move into the right ventricle. And when the ventricle contracts, the right ventricle is going to move or pump the blood into the pulmonary trunk, okay, which is the pulmonary artery is a part of that. Okay, so from there, blood's going to move from the artery, pulmonary artery, to pulmonary capillaries. Where? In the lungs. All right, so they're going to pick up oxygen, get rid of carbon dioxide. Then from there, blood's going to flow from the lungs through the pulmonary veins, okay, into the left atrium. So that is the pulmonary circuit, okay, going from the heart to the lungs, back to the heart, okay. Also have the systemic circuit, okay, it's for all your other arteries and veins. So the major pathways for blood in the systemic circuit, your aorta and your vena cava, superior and inferior. Aorta is your largest artery, inferior and superior vena cava, largest veins. So your systemic circuit is going to start in the left ventricle. Okay, when the ventricle contracts, blood's going to move into the aorta. And then blood will go from the aorta to different branches of the aorta and go to your major body regions and organs. Okay. So what are some of those major branches of the aorta? Okay, so you have your ascending aorta, okay, where the aorta is curving up. You have your left and right coronary arteries there. Okay, and that's going to take blood to the heart, not into the chambers, but toward the outside of the heart, so the heart can actually beat, it can contract. Okay, so if your heart didn't get blood flow back into the tissue of the heart, it wouldn't be able to contract because it wouldn't have any nutrients, it wouldn't have any oxygen. Then you get from the aortic arch, or from the ascending aorta to the aortic arch, branches off of that are brachiocephalic artery. Branches off of the brachiocephalic artery include the right common carotid and the right subclavian. Okay, as well as the left common carotid artery and left subclavian artery. These arteries are going to supply your right side of your head, right shoulder and limb, left side of your head, left shoulder and upper limb. Okay. Now, after we've gone past the aortic arch, you go to the descending aorta. Branches off of that are the thoracic aorta and the abdominal aorta. So, parts of the body that are supplied by that include your thoracic wall, your liver, spleen, your stomach, small and large intestines, your kidneys, ovaries, testes, lower parts of your digestive system, pelvic organs, and your lower limbs. Okay. Okay, so this image shows you some of the major branches in the systemic circuit, all for the aorta. Okay, so here's that brachiocephalic artery, right common carotid, so left common carotid, or left common carotid here, left subclavian, right subclavian, your descending aorta, your thoracic aorta, your abdominal aorta, okay, femoral artery, popliteal artery, and that's the front of the knee, or sorry, the posterior part of the knee is popliteal. Anterior tibial, by the tibia, or tibia, fibular, by the fibula. Okay, so those are some of the major ones in the lower limb. What about the upper limb? Axillary artery, kind of going toward the armpit. Here's the intercostal artery by the ribs. Okay. Brachial artery, radial artery. Okay, ulnar artery. Okay. Okay, so once blood's gone to the tissues, it's got to come back to the heart, right? Yes, no, right? It's got to go back to the heart. So how does it do that? Well, blood returns to the heart via veins, right? So the arteries take blood away from the heart. In the systemic circuit, they're carrying oxygenated blood. Blood goes into capillaries. Oxygen gets released, as well as nutrients. The capillaries, then blood goes from the capillaries to the veins to return to the heart. Well, what veins are returning that blood to the heart? All right, so you have the right and left brachiocephalic veins. They're draining the head, neck, and upper limbs. Okay, there's a brachiocephalic artery, brachiocephalic vein. What does brachio mean? Anybody remember? Arm. What about cephalic? Head. So it drains your head, neck, upper limbs, and forms the superior vena cava. And you have your right and left common iliac veins. Okay, what part of the body is associated with iliac? Your hip. Very good. So this is draining your lower limbs. It helps to form your inferior vena cava. Left and right renal veins. Renal means kidneys. So it drains your kidneys and it enters your inferior vena cava. Your left and right hepatic veins. Hepatic means liver. Okay, and this is draining your liver, digestive tract, and spleen, and that also enters the inferior vena cava. Okay, and your inferior vena cava and your superior vena cava feed into your right atrium. Okay, returning that blood back to the heart. All right, so here's your right brachiocephalic vein, left brachiocephalic vein, coming together to form the superior vena cava. All right. So in the arm, you got a radial vein and an ulnar vein feeding into the brachial vein, to the axillary vein, to the brachiocephalic veins. Here's your hepatic vein for your liver, and renal veins for your kidneys, common iliac vein here in the hip region. Okay. So common iliac helps form the inferior vena cava. Hepatic and renal veins they will feed into the inferior vena cava. Femoral vein, popliteal, anterior tibial, they will all, great saphenous, they will all feed into the common iliac vein, which feeds into or forms the inferior vena cava. All right, that's the major circulations of the body, or circuits. We also have some special systemic circulations. Before we do that, I'd like to take a break, and I want you to talk with your partners about the parts of the pulmonary and the systemic circuits. Okay. You can do this at home as well. All right, so the hepatic portal system. So this is a special type of systemic circulation. So it's going to carry venous blood from the stomach, intestines, other organs into the liver, right? Because this is a hepatic portal system. So it's hepatic, so it goes to the liver. And capillaries of your digestive tract will actually empty into the superior, mesenteric, and splenic veins. Okay. Your superior, mesenteric, and splenic veins are going to join to form your hepatic portal vein. You also have gastric or stomach veins that'll empty into the hepatic portal vein. Okay, so in the hepatic portal system, nutrients and waste will diffuse into the cells of the liver. And then the hepatic veins are going to drain the liver, and from there, the blood goes into the inferior vena cava. All right, and this is important because, your kidneys will filter like sodium ions and water out of your body as necessary, but a lot of other materials that are waste are actually filtered through your liver. Okay, so you kind of need to have a way of moving blood into your liver so that your liver can actually destroy things that aren't good for you. Okay. All right, so here's a picture of that. Here's your hepatic portal vein. Here's your, kind of see it behind the stomach, your splenic vein feeding into the hepatic portal vein. right. Your gastric veins also feeding into it. Superior mesenteric vein from your large intestine feeding into the hepatic portal vein, and they're feeding into the liver, having processing going on there, and then feeding into the inferior vena cava. Okay, your hypothalamus and it forms what we call the hypothalamus hypophyseal portal system. All right. And this has to do with blood supply to the brain. Okay, so, brain's special. It would make sense that it would have its own type of blood system, right? Or a blood pathway of blood to the brain. All right, so your anterior, front, posterior, back, cerebral arteries, and the carotid arteries in your throat supply your brain with arterial blood, okay? Blood from your systemic circulation. You'll actually form what we call a cerebral arterial circle. It just forms basically a loop. We call that circle of Willis. Okay, it provides some alternate routes for getting arterial blood into your brain. Okay, so if one pathway gets blocked, there's other pathways to get blood into your brain, which was pretty important so that your brain never runs out of blood. Also helps to equalize blood pressure in your blood supply to your brain, okay, because you don't really want high blood pressure going towards your brain. All right, so this region here, this is your circle of Willis, okay, big forms a loop. All right, so you have your anterior communicating artery, anterior cerebral arteries, your internal carotid arteries, your posterior communicating arteries, okay, basilar artery. All these are feeding in to form circle of Willis. Equalizes arterial blood flow to the brain. Okay. Also, it should make sense to you that blood flow for a pregnant mother to the fetus would be sort of special or different. Okay. So, you have 4 circulatory features that you don't see in adult circulation. So in the adult circulation, when we think of the foramen ovale, we think of a foramen in the skull. All right, this is actually part of the circulatory system in the fetal circulation. Ductus arteriosus, umbilical arteries. All right, so these really are arteries you'd only see in fetal circulation. Right, think about the umbilical cord, right? And the ductus venosus. So why do we have this system? Well, the fetus is still inside the body, the baby's still inside the body. So it's not really breathing or using its lungs in the way that you would when you're outside of a mother's body. Okay, so it's got to have a pathway to get oxygenated blood to your body. All right, so the path of blood in the fetus starts at the right atrium. You have most of the blood entering your left atrium through the foramen ovale. Okay, so there's basically a hole in the heart. And blood actually spills from the right atrium to the left atrium. And blood that's entered the right ventricle and then goes into the pulmonary trunk actually gets shunted toward the aorta because it doesn't need to go to the lungs, right? Because they're not picking up oxygen there. So the ductus arteriosus moves that blood over into the aorta. So you get an exchange between the maternal blood and the fetal blood. Why? Because the maternal blood's got oxygen. And that happens at the placenta. So the placenta is essentially serving as the lungs, okay, as well as serving as your intestines, because that's where your nutrients are coming in as you're an adult. Okay, so it's, you know, the fetus or baby's picking up oxygen and nutrients through the placenta. So blood in the umbilical arteries is going to be oxygen poor. Okay, and then blood in the umbilical veins is going to be oxygen rich. And it enters the ductus venosus. Okay, it's oxygenated going to the ductus venosus. And your ductus venosus then is going to join with your inferior vena cava. So different pathway. And you might think, okay, well, why? Let's see. All right. Well, why is oxygenated blood going to inferior vena cava? Why? Because inferior vena cava feeds into the right atrium. And at that point, blood's going to spill through the foraminal valve over into the left atrium. Okay, so some of that blood's going to get pumped to the body through the systemic circuit. Whatever doesn't goes into the right ventricle, goes into the pulmonary trunk, and then gets shunted away from the pulmonary trunk through the ductus arteriosus to the aorta, and still goes to the body. All right. So here's the fetal heart. All right. So blood in the right atrium can move into the left atrium via this foraminal valve, this oval-shaped hole. Okay. Blood. All right. Okay. So here's your pulmonary artery. Blood can get shunted away from the pulmonary artery via the ductus arteriosus up here. Okay. Bring that blood back to the heart. Okay. Blood's going to go to the placenta, pick up oxygen. Okay, return to the heart. Okay, return via the ductus venosus. Okay, down here. And your ductus arteriosus and ductus venosum, they actually become ligaments. Okay, so when you get older, they go away because they're not needed at that point. Okay, so let's talk about these special circulatory routes with your partner. Okay, let's do that now. You can do this at home as well. So let's talk about how aging affects your cardiovascular system. So as you get older, your heart gets larger. But in many middle-aged people, okay, the heart actually gets covered by some fat. Okay, typically has to do with diet, right? So Also, the amount of collagenous fibers, the amount of collagen you have in your endocardium on the inner layer is going to increase. Your valves actually get thicker and more rigid. Your myocardium loses some contractile power, so it's not as strong in its contractions, as well as it loses some ability to relax. So its recoil ability is not as strong. And the resting heart rate starts to decrease. Okay. So you're getting fewer beats per minute. What about the arteries as you get older? Well, it's common to get atherosclerosis or arteriosclerosis. So this has to do with kind of hardening or thickening of the arteries, or narrowing of the arteries, excuse me. You have increased likelihood of getting a coronary thrombosis. Remember, that's when a blood clot moves from one location to the other. And increased chances of heart attacks. You see an increased occurrence of varicose veins. So if any of you work in nursing homes or work with a lot of elderly patients, you probably have seen a lot of blood vessels on the surface of the skin. Okay. And this can also lead to thromboembolism or pulmonary embolism, where that blood clot lodges somewhere in the body, lodges in the lungs if it's a pulmonary embolism. Okay. Okay, another effect of aging, congestive heart failure. So the left side of the heart gets damaged and stops pumping blood adequately. The blood's going to back up in your pulmonary circuit. Pulmonary blood vessels get congested, causes edema or swelling in the lungs. Typically, you're going to see this, or associated with this, you're going to see shortness of breath, constant coughing, and fatigue. So how do you treat it? Well, you can give the patient diuretics, help them increase their urinary output. You can give them digoxin. You can increase your heart's contractile force, how hard the heartbeat's contracting. And it should make sense because, again, congestive heart failure means the heart's not pumping adequately. So if you can give a drug to increase the contractile force, it could improve heart's ability to pump. Also can give the patient dilators, help the blood vessels relax, open up some more. Okay, improve blood flow. Okay, homeostasis, right? Equilibrium, balance. They usually end up every chapter with some mention of homeostasis. So your cardiovascular system is involved in maintaining the composition of your blood, the pH, and the temperature, right? So pH has to do with acidity or basicity. So a few examples here. You have growth factors, and they can regulate manufacture or production of the formed elements from the red bone marrow, right? Remember that from the previous chapter for formed elements. All right, the digestive system is going to absorb nutrients in the blood. Your lungs, your kidneys get rid of metabolic waste, right? Kidneys get rid of sodium, urea. Your kidneys or lungs get rid of carbon dioxide. Kidneys help you with pH, okay? Help you maintain right? pH in your blood. Blood also can distribute heat around your body. Okay? That movement can also distribute heat. So if you have good blood flow, you're usually going to be warmer. If you don't have good blood flow, you're going to probably be colder. All right. Blood vessels in your skin can dilate or constrict, so they can get, basically they can expand or they can constrict in response to the differences in temperature. All right, your cardiovascular system is involved in maintaining blood pressure. So in your aortic arch, you actually have sensory receptors, and they can detect, they can detect changes in blood pressure, particularly decreases. So lymphatic system, its role is to collect excess fluid that accumulates after blood's gone to the tissues. And that helps regulate the volume of your blood by how much fluid has been absorbed, as well as blood pressure. Okay, if you have more blood or more fluid in the blood vessel, you're going to have a higher blood pressure. Endocrine system, nervous system, they collaborate, work together, regulate blood pressure. Okay, venous return. This means how much blood comes back to the heart from the veins. It's supported by your muscular system, your respiratory system, right? So your lungs, in terms of their ability to allow, remember we have sphincters at the capillaries in your lungs. They can control how much blood flow gets into the pulmonary veins. And with your other veins, in your systemic circulation, remember they don't have a lot of muscle, smooth muscle in them, right? Compared to arteries. And the skeletal muscles around them, when you move your body, you're actually squeezing those veins. And that helps move blood up to the next valve in your veins so that you move blood back to your heart. Okay. So that is the cardiovascular system. Okay. So we are going to end this video and we're going to move on to the lymphatic system. Okay.